Vaccine hesitancy is rooted in a long history of medical care in the U.S. Some Americans, in fact, have always been wary of mass vaccination efforts, dating back to the 1700s with the smallpox shot. From there, you had the 1918 flu outbreak, you had polio in 1955, the swine flu in 1976, and in 2009, you had H1N1. One medical historian at Princeton once put it this way: there is a history of the question of how you balance individual liberty, the right to refuse, versus the policing of the public health. And that is what we're seeing really happening nationwide right now when it comes to the vaccine. Joining me live tonight is Dr. Jay Bott, a primary care physician with the University of Illinois in Chicago. Dr. Bott, appreciate your time. I think that's a good place to start, looking back at the history and what we have learned about vaccines and their efficacy in eradicating and addressing diseases when it comes to public health. What have we learned over these years?
Marnie, thanks for having me. It's great to be here. We've learned that vaccines can save lives. We know that we've eradicated some conditions and diseases that have really cost lives and have made people really sick. Now, with that progress, we've also learned along the way, learned what works, what doesn't work, how we might produce vaccines. And along the way, we've also caused mistrust, whether it's been through institutions, medical institutions, or government. And so we're struggling with that now because with progress, we're fraught with challenges related to mistrust, which causes people to question and fear injecting a biological into them, or not sure if this will really help them. So, even though we're making a lot of progress, there's still some challenges, including historic things like Tuskegee or Henrietta Lacks, and those situations in which we weren't really honest with those that we were engaging with. But that being said, I think it's not just about hesitancy, it's about access, about deliberation, how people are making choices, whether they're ready or not. And it takes a number of conversations sometimes to get them there.
Well, and another layer and component to that fear, and I know you're meeting with patients daily and they have questions for you, is about the speed at which this vaccine came to market. I mean, you look back in history and it took years for some of these vaccines to be developed. With COVID-19, they think it was rushed, it was too fast. I'm worried about the risks. So what do you say to people who are on the fence for those reasons?
Yeah, I hear that daily with my patients. And I think what's the misperception is that it just appeared out of thin air and it was magic and it happened so quickly. But the reality is the work around this vaccine for COVID-19 was based on decades of research around coronaviruses, the common cold, MERS, SARS, H1N1. We know about these viruses and decades of research on mRNA platforms or the ways that vaccines get developed and delivered to save lives.
So you're saying this vaccine went through the proper channels, is safe to take, even though it was a lot less time than the others.
Exactly. So they had a jump start. Think of it that way. They had the research and experience to build on, and then laser focus money and time and resources and people to get us to the FDA approval process, which was the same as any other vaccine or medicine that has gone through our process before. So I feel very confident that there are safe, highly effective vaccines that are in play right now.
The other thing we're seeing right now, Dr. Bott, is these breakthrough infections, people who have received the vaccine, but they are still testing positive for COVID. What should we take away from that in terms of where the virus is right now and what this means as a whole?
Yeah, we have known, and this goes back to your first question about the history of vaccines, that they're not going to be 100% perfect. We know that there's risk of breakthrough infections. What's happening, I think, is that it's being taken out of context. The most important thing to remember is that we know infections can happen, but 95% of people don't get severe disease, hospitalized, or die from that infection. So it's about the amount of viral load that you get in your body. You just get a lot more if you're not vaccinated versus if you are vaccinated.
Similar to what we see with the flu every year, right?
Exactly.
There's always a chance. Given the rise that we're seeing in cases, I mean, in some areas tripling from what we had been seeing previously, especially with the Delta variant, a lot of misinformation out there about the vaccine, which we're trying to clear up right now. What are you most concerned about as we move into the fall? Of course, the weather gets cold, we head inside, kids are going back to school, and we see this uptick.
Right, we're still having a lot of people with pockets of unvaccination. We have kids under 12 that are not vaccinated. We have going back to school in the fall and being indoors. That's just recipes for a further breeding ground for other variants that we might be in a situation where we need to pivot quickly and we can't handle in the moment. And so I worry about us prolonging a pandemic that we could actually get out in front of and stop ASAP.
Now is our moment.
Yes.
Now is our time. Dr. Bott, we appreciate it. Thank you.
Thanks for having me.